Visual snow, ever heard of it? Most people haven't. This mysterious condition is often overlooked and misunderstood, even by those who experience it. Yet, it's estimated that up to 5% of the population experiences this perplexing condition. That's a significant number when you consider the global population. Imagine millions of people worldwide living with a constant visual disturbance. This disturbance is something that many doctors struggle to diagnose and treat. The symptoms can be so subtle and varied that they often go unnoticed or are mistaken for other conditions. Imagine seeing the world through a static television screen, even with your eyes closed. This is what those with visual snow experience every day. The visual noise can be constant and unrelenting. This persistent visual noise can range from a mild annoyance to a debilitating disruption, affecting daily life in profound ways. It can make simple tasks like reading, driving, or even recognizing faces incredibly challenging. Despite its prevalence, visual snow remains largely misunderstood. Many sufferers spend years searching for answers, often consulting multiple specialists without finding relief. The lack of awareness and understanding can be incredibly frustrating. The lack of awareness surrounding visual snow is concerning, particularly given its potential impact on mental health and quality of life. The constant visual disturbances can lead to anxiety, depression, and a sense of isolation. It's time to shed light on this enigmatic condition. By exploring its potential causes, we can better understand how to treat it. Empowering individuals with the knowledge and resources they need is crucial. Support groups and online communities can provide much-needed comfort and advice. Researchers are beginning to take notice, and studies are underway to uncover the underlying mechanisms of visual snow. This research is vital for developing effective treatments and improving the lives of those affected. In the meantime, individuals can explore various coping strategies. Mindfulness practices, such as meditation and yoga, can help manage the stress and anxiety associated with visual snow. Engaging in hobbies and activities that bring joy can also provide a welcome distraction. Assistive technologies and adaptive tools can make daily tasks more manageable. Having a supportive network of family and friends is also invaluable. Together, we can raise awareness and support those living with visual snow. By increasing awareness and understanding, we can foster a more compassionate and informed society. Let's work together to bring hope and support to those affected by visual snow and ensure they no longer feel alone in their journey. Visual snow is a neurological condition characterized by a persistent visual disturbance that resembles static or TV noise. This condition is not just a fleeting inconvenience, but a constant presence that can significantly affect one's quality of life. Imagine a subtle but constant flickering across your entire field of vision, present whether your eyes are open or closed. This flickering can be likened to the static you might see on an old television screen, but it's always there, never giving your eyes a moment of rest. This visual noise can vary in intensity, color, and pattern, often accompanied by other visual phenomena such as after images, light sensitivity, and even seeing flashes of light. These disturbances can make it difficult to focus on tasks or enjoy visual experiences. The impact of visual snow on daily life can be significant. Simple activities like reading a book, working on a computer, or even driving can become daunting tasks. The constant visual interference can make it hard to concentrate, leading to mistakes and a sense of frustration. Reading, driving, and concentrating can become challenging, leading to frustration and anxiety. The persistent visual disturbances can make it feel like you're never able to fully relax or focus, which can be incredibly draining both mentally and emotionally. Social situations may feel daunting, as individuals may worry about their vision or feel misunderstood. The fear of not being able to see clearly or the anxiety of explaining their condition to others can lead to social withdrawal and isolation. The constant presence of visual snow can be mentally and emotionally draining, impacting sleep, mood, and overall well-being. Many sufferers report difficulty sleeping due to the visual disturbances, which can lead to chronic fatigue and a decrease in overall life satisfaction. Despite the profound impact visual snow can have, many sufferers hesitate to seek help. The fear of not being understood or taken seriously by medical professionals can be a significant barrier to seeking treatment. They may fear being dismissed or not taken seriously, particularly since the condition remains poorly understood within the medical community. This lack of understanding can lead to feelings of hopelessness and frustration as sufferers struggle to find effective treatments or support. It's crucial to raise awareness about visual snow, encourage open communication between patients and healthcare providers, and foster a supportive environment for those living with this challenging condition. By increasing awareness and understanding, we can help those affected by visual snow feel less isolated and more empowered to seek the help they need. Support groups and awareness campaigns can play a vital role in providing the necessary resources and community for sufferers to share their experiences and find solace in knowing they are not alone. Visual snow is more than just seeing static. It's a complex and often misunderstood condition that affects the way people perceive the world around them. It's often accompanied by a constellation of visual symptoms that can vary significantly from person to person. These may include after images, persistent images that linger after looking at something bright. Imagine looking at a light bulb and then seeing its ghostly outline for minutes or even hours afterward. Palinopsia. Seeing images repeatedly like a visual echo. This can be particularly disorienting, making it hard to focus on the present moment when past images keep intruding. Photophobia, increased sensitivity to light. Everyday lighting conditions can become unbearable, forcing individuals to wear sunglasses indoors or avoid bright environments altogether. Floaters, small, dark shapes that drift across the field of vision. These can be distracting and make it difficult to concentrate on tasks that require visual focus. Blue field entoptic phenomena. Tiny, bright dots that move rapidly across a blue background. This can be particularly noticeable when looking at the sky or a plain, bright surface. One of the biggest challenges facing individuals with visual snow is the lack of medical understanding and recognition. Despite the clear and often debilitating symptoms, many healthcare professionals are unfamiliar with the condition. Because the condition doesn't always present with obvious physical signs, it can be difficult to diagnose. Standard eye exams often come back normal, leaving both patients and doctors puzzled. Many sufferers endure a long and frustrating journey, seeking answers from multiple healthcare professionals before finding someone who understands their condition. This can involve numerous appointments, tests, and even misdiagnoses. This lack of awareness can lead to misdiagnosis, inappropriate treatment, and a sense of isolation for those affected. Patients may be told that their symptoms are psychosomatic or that they simply need to learn to live with them. However, there is hope. Online communities and support groups have become invaluable resources for those with visual snow. They provide a platform for sharing experiences, coping strategies, and the latest research developments. Researchers are also beginning to take notice. Studies are being conducted to better understand the underlying mechanisms of visual snow and to develop effective treatments. For those who finally receive a diagnosis, it can be a huge relief. Knowing that their symptoms are real and recognized can be the first step towards finding effective management strategies. While there is currently no cure, various approaches such as mindfulness, lifestyle adjustments, and certain medications can help manage the symptoms and improve quality of life. With increased awareness and ongoing research, there is hope that one day visual snow will be better understood and more effectively treated, bringing relief to those who suffer from this challenging condition. While the exact causes of visual snow remain unknown, research suggests a strong neurological component. The condition is thought to arise from abnormal activity or communication within the visual processing areas of the brain, rather than a problem with the eyes themselves. Studies have shown differences in brain activity and structure between individuals with and without visual snow. For example, some research suggests that visual snow may be linked to hyperactivity in certain areas of the brain responsible for processing visual information. Others point to potential abnormalities in the way the brain filters and interprets sensory input. Further research is crucial to unravel the complex neurological mechanisms underlying visual snow. By understanding how the brain processes visual information and identifying specific areas of dysfunction, researchers can develop more targeted and effective treatments for this often debilitating condition.